Hi, I'm Brad Haywood, Executive Director of Justice Forward Virginia. This is a brief explainer video about defelonization of simple possession of drugs. So, one of Justice Forward's top line legislative priorities for the 2022 session is defelonization of drug possession. So, right now, possession of most drugs of abuse, so things like cocaine and heroin and LSD, many others, possession of those items or those substances is a felony, and it's punishable by up to 10 years in prison. Usually people don't get that much time, but that's the potential punishment, up to 10 years in prison. In addition to that maximum punishment, people who are convicted of drug possession are felons for life. They, with all of the collateral consequences that go along with that, things like loss of housing, loss of public benefits, potentially impact child custody, ineligibility for student loans, and less employability, all these various things that prevent somebody from moving forward with their lives. And those present actually an incredible impediment for people who legitimately have substance use disorder. So the disease of substance use disorder. Many people who use drugs don't have any disease at all. They just do drugs because they enjoy doing drugs. But at the very worst, drug use is a disease and a public health problem. And this is the way that I tend to frame this issue, which is that if we started all over with brand new laws, and say we didn't have a criminal code at all, there were no laws at all yet, and we had to decide what to do about somebody who had a little baggie of cocaine in their pocket, would you, at that point, would you slap them with a felony conviction, make them less employable, make them lose their housing, make them lose their job, make them potentially have lose their kids or lose their student loans? Of course you wouldn't do that. So if you wouldn't do that in this theoretical world where we're starting over, why are we doing it now? And it's a great question. So I don't know why we're doing it. The benefit of defelonizing drugs is immense. Not only do you have improved public health outcomes, not only do you have take a more humane approach to this public health issue, you also have a massive cost savings. And this might be why defelonization has become the law in 18 states, including many red states. This is a key talking point for when we're talking with Republican legislators. So like I said, 18 states have already defelonized drug possession. Now, some of them make drug possession a felony by like a third offense, but that remains the first time you're charged with this, usually the second time as well, it's a misdemeanor at most. So that includes states like Mississippi, Utah, includes Oklahoma, which is one of the most recent states to defelonize drug possession. And in Utah, here's where we get to the cost argument. In Oklahoma, the first year after defelonizing drug possession, it was more than 10,000 fewer felonies were indicted by Oklahoma prosecutors. And just think about the savings that is incurred through that. 10,000 fewer felony court cases, fewer felony arrests, probably hundreds fewer jail and prison sentences, people on community supervision. All those things cost a lot of money, and Oklahoma saved a lot of money as a result. So what do they do with that money? And this is the last part of why this policy makes so much sense. Is you take that money savings and you don't just save it up for a rainy day. You actually invest in behavioral health infrastructure. So things like mental health treatment, substance abuse treatment, things like community treatment programs, residential treatment programs, detoxification facilities. So these are the things that Virginia really lacks right now. So in Arlington County, where I'm chief public defender, we have a Department of Human Services that receives about $150 million a year. And we don't have a single long-term residential drug treatment facility, not one in the community. The only one that we have is in the jail, and it's called the ACT unit, and it's a fine program, but in order to access those kinds of treatment services, you have to be in a jail, and you have to be in a jail probably for 9 to 12 months, which is nuts. Like, we ought to have community programs where people can get the treatment they need. In many areas of Southwest Virginia, they don't have any detox facilities. So somebody who's in a critical stage, detoxing off really powerful drugs like fentanyl or methamphetamine, they need a safe place to medically detox, and they have nowhere at all. And this is also why you get so many of these jail overdoses. Those have become an epidemic during our pandemic. People get arrested who are detoxing off drugs. Sheriff's deputies aren't equipped to treat that. And what ends up happening, they don't get the services they need, and unfortunately you have some really tragic outcomes as a result. So lastly, I would say drugs. I think drug possession is the #1 felony conviction in Virginia. Why are we doing this? Why are we so addicted to the traditional model of arrest, prosecution, and punishment? We know that war on drugs is broken. This is our first big step away from that. Once you defelonize drug possession, you can start thinking of even better policies like decriminalization, which they've done in Oregon, and that represents an even larger savings. It eliminates those black markets that produce violence and drug trafficking, and it allows people to have safe access to things like basically use or be treated more safely. So that's it. I hope this makes sense. I know a little bit longer than I expected, but 6 minutes is it. So defelonization of drug possession. Thanks for watching.